Okay, hi, welcome to Fertility Talks. This is live post number 166, and we are going to be talking about fertility clinics reopening. And here we are with Dr. Baratz, once again, one of our favorite fertility doctors, and he works out of Create Fertility Center. So thank you and welcome for being here again, Dr. Baratz.
Thank you, Mary.
Um, I haven't prepared a long intro of your bio because we've done it before, and I figure you're now a well-known figure in this space. So I think we should just get on with it. And myself, in fact, if this is your first time watching Fertility Talks, I'm Mary Wong, and I'm the founder and director of Alive Holistic Health Clinic. I'm the author of Pathways to Pregnancy and your host and creator of Fertility Talks, and your acupuncturist and guide to your fertility journey. So I am honored to have you here once again. And this is such a relevant topic because here we are in the middle of COVID, and there are places in the world that I do know have fertility clinics be open. And so we're going to talk about specifically here now in Ontario, and perhaps also make mention of other places and jurisdictions around the world. So let's talk specifically. Well, you know, in your clinic, is it open? And if not, are you opening in the near future?
Well, let's go back a step, Mary. So I know you didn't provide my bio, and thank you for that, because as people provide my bio, it makes me feel a little bit more mature as opposed to youthful. And so I just want to start by saying that, I've been in clinical practice for about 20 years and, or 50, almost 20. And this is unprecedented. Like even in the last H1N1, in the previous SARS-1 epidemic, this is unprecedented. And it's been unprecedented in terms of its scope and in terms of its reaction. And I have to give you credit for hosting this live event, because we talked about this a couple of months ago when closure was starting. And then I thank you for hosting me, because I mentioned to you, I said, you know what, we're opening again. We have to talk, because now we have to provide people with this response. And what does opening mean? So I really appreciated the post, the Facebook post, because I think it really is very interesting how you have an image of a door opening slightly with question marks, and there's sort of two or three question marks, which really underpin the questions that we're asking. So the first big question was, how do we open? And we'll talk about that. And then I think another question is, when do we open? Which is more becoming increasingly relevant.
Yeah.
So I just wanted to put that little primer out there to thank you for being so proactive and educating all of us about what's going on, because there's a lot of mixed messaging, and it's very difficult to figure out what's going on in your locale versus your larger, let's say your provincial area, nationally, in the world. Many of us are using CNN or very sort of large media platforms that may or may not reflect what's going on specifically. So I need to put that out there, that whatever I comment on, both for clinical medicine as well as for direction, may be appropriate for downtown Toronto patients, but may not be the same for people in the East Coast, West Coast, and everywhere in between. So I really do encourage people to visit their own clinics' websites or social media platforms to get a more specific answer. But what I'm happy to do is provide what we're looking at, mostly on a province level as well as in the GTA.
Okay. And then, I do want to put it out there that you did reach out to me and say, oh my goodness, we have to provide this kind of information for people as it's happening in the moment. And so for those of you who have watched Fertility Talks, it normally lands on a Wednesday evening. And this is like, okay, an emergency, let's get it going. And we're doing it on a Monday night. So thank you all for being here and watching this as well.
So let's talk about opening. So open is a very general term, because if you use the same definition as what open meant pre-COVID, it's very different to the opening that we're talking about right now, right? So pre-COVID, opening involved walking into your clinic without any screening, typically unannounced, high volumes, high throughput, and opening was, in all senses of the words, very open. And I think that the definition of open that we're talking about right now may seem like closed compared to what we were before. But what we mean by open is open to initiate all types of fertility treatment that were being performed before COVID. So that means full gamut of diagnostic procedures, full gamut of interventions, and so that's really important to underpin, because most clinics have been open to a certain extent for emergency procedures, for cancer-based fertility care, and for a very narrow slice of diagnostics. And so what we're suggesting is that we are now preparing to open up for all of those procedures.
Mm-hmm.
It's just, how do we do it? How do we do it and when? So please, interject, Mary, because this is a very long conversation. I don't want to sound too long-winded, but in terms of, maybe we just talk a little bit again about the how, and then we'll get into the when, okay? And then we can come back if we need to.
Right.
So how do we
let's
open?
Just go back for 1 second, because how it was open, because it's not as though you were closed, but it was very limited in terms of, as you said, more of that emergency care and through virtual consultation. But what you're speaking to and addressing is, how are we addressing the procedural piece, right?
Right. So first of all, there's certain aspects that and I think every industry, every area of medicine, many industries have learned that face-to-face contact is really a premium and may not be required in all situations. So just like many of the business world or many other industries have sort of put a real, they've really put into question how much travel, how much face-to-face meeting is required. In the medical space, we are still committed to limiting face-to-face contact. So there's a really good chance that even though we're opening, consultation will still be via telemedicine, which I think is has always been a powerful tool for patients from abroad. But we're realizing that it does allow us to open more properly now, so that we minimize the flow through the clinic. So there's a general principle in terms of the how, to minimize face-to-face contact. And do that in terms of not having as many support people in the clinic, meaning if you have a spouse or partner, children, they really are, we love them, we want them to be part of this process, but they're not helping limit the number of people in the clinic. And as I mentioned, the consultation would be very limited. So we'll bounce back and forth when we talk about when we do open, which for most clinics, we're discussing opening mid to end of May is the plan. That opening will be very different than before, and we will really not welcome people to bring their partners or spouses unless they're required for the treatment. So, for example, in the case of males, providing a sperm sample, that would be an example, one of the only examples where you would need a partner. Or for procedures, which again we're starting to do come in the next couple of weeks, you would need someone to bring you home, so that that partner or support person would have to have access to the clinic. But even to access the clinic, even if you try to go to your clinic tomorrow, the screening process is really going to incorporate two aspects. So one aspect is a heightened level of pre-screening, meaning pre-screening means before you even come to the clinic, if you think you have any of the classic COVID symptoms, so generally feeling unwell, fever, cough, cold, there are actually other symptoms that have been described with COVID, any sensory changes like smell or taste, even severe illness like bowel changes, those may be signs of COVID, or contact with a COVID person, we're asking that you don't come to the door. You should pre-screen yourself and say, you know what, maybe I'm ill, I'm unwell, and either visit a COVID testing center or wait until those symptoms subside and then reconsider visiting. So that's called pre-screening, which any clinic or place that you visit will start to require a phone call or email prior and ask those classic COVID screening questions.
Right.
Did you have a question about that? Sorry.
No, I was just going to actually ask that specifically. So is it a phone call? Is it email? And you just said it.
Well, right now, because the volumes in clinics are so minimal, there's a natural reduction in access. Like, not many people are coming to the clinic. But as we start to open in the next couple of weeks, in Ontario and soon, and hopefully soon in other provinces, there'll be more volume, and so that everyone's at more risk. So the pre-screen is very critical. And then the other piece is the actual at that point of contact screen. So one of the other mandates or the other guiding principles is that every institution, clinic needs to have some type of screening mechanism at the entry point to the clinic. And that screening involves either nurse or other type of provider that is protected. So with the proper level of PPE, and there are different forms that are acceptable. Temperature gauge, like some kind of thermometer. They have these new infrared ones, which looks like a little kind of sensor to the forehead, or a traditional ear thermometer, and a questionnaire, as well as documentation. So everyone coming and going from a clinic, there needs to be documentation as well. And that's important for contact tracing, which we can talk about a little bit at the end. So there'll be a pre-screen and then a at point of contact screen, which is there again to try and protect people coming into the clinic and protect people that are in the clinic, both the staff and other patients that are there.
Absolutely.
Yeah.
So then my question becomes as well, women often, when they cycle monitor, they're coming every day, almost every other day. So is there going to be a limit in cycle monitoring? You know, especially like
Right.
in an IUI versus an IVF, it might be different.
Right. So again, back to the guiding principles, and this is what's become very difficult for other areas of our society, like restaurants, movie theaters, is how do you host a number of people in a specific space? So it's actually some provinces and some cities have given number distinctions. They've said you can only have 10 or 15 or 20 people in a space. I think that's going to change. And then what the guiding principle will be, and if you looked at the newspapers or the media for Ontario, the message has been go out, but you have to maintain the social distance. Right. So that means maintaining the 2 meter, 6 feet. If you can't maintain that, using masks or some form of a mask for protection. So that's the idea in our clinic. In general, the number of 25 to 50 people is sort of the sweet spot that we believe we can handle. Again, those numbers may change, and also depends on the space that you have. But the idea is to maintain the social distance, even when social distance is more difficult to maintain, for fear of contaminating or infecting people. But I think the other key point is that if your clinic was one that had more of an open flow policy, where appointments, which many clinics did not really have appointments for cycle monitoring, it was more of an open access, there's a very good chance that your clinic will have appointments for every aspect of care, whether it's blood testing, ultrasound, sperm testing. Obviously, consultation was always based by appointment, but even the cycle monitoring will likely be by appointment. And the reason simply is to space out the number of people that are coming through.
Right. And I imagine, and coming from a patient perspective, that might actually be working in their favor, because then they can show up at their time of their appointment versus waiting for the blood work, the ultrasound, the seeing the doctor. So maybe that's actually a positive thing.
Well, it's definitely will streamline care. It will definitely allow people to move through the clinic more rapidly, which, even though it was driven by COVID, as a COVID response, you're absolutely right. There are definitely silver linings to that. I think the overall silver lining is that it's just another symbol that society is opening. I mean, even in our conversation, the fertility clinics opening is inspiration to have the TCM clinics open, which might be inspiration for other areas. So, look, to me, it's all a symbol. Even though outside it doesn't look like spring weather, it feels like an opening, just like spring is typically a season where things start to bloom and blossom. I have to use that analogy there. It feels like that's really what's happening, is that we're all sort of coming out of this COVID slumber and trying to, not in an exaggerated way, but trying to make up for quite a bit of lost time.
Absolutely. So, when you're saying we have to spread the number of people and through the day, then what happens? Because typically I find that clinics are so full. Does that mean that you have to push back some of the people with regards to their cycle monitoring or their IVF procedure? Because ultimately you can't have the same number of people doing the same number of procedures per day, or can you?
It would be very difficult, because if you are doing the spacing that we described, we'd be working till like midnight every night then. I mean, it would be very, very challenging. So I think we have to look at the glass half full, not half empty. I think we have to look at the procedures that we are doing versus the ones that we're not doing. And with your specific provider, there probably will be some type of triage system that your clinic will use to make sure that there can be a timely provision of fertility care to those that need it. But as I mentioned, I mean, we're not talking about years of wait time. I mean, I know many people have already been delayed by a couple months,
Mm-hmm.
which we all agree is it's questionable how acceptable that is, but given the extreme of the times was required, I think things are going to move much more quickly now. There also will be some people that will self-select. I think people that are better prognostic patients may decide, you know what, maybe I shouldn't be in the clinic right now. Even though I want care, I'm not so comfortable going to a space where there's going to be many people. And we're seeing that in many areas of medicine, certainly in hospital-based care. Many patients are just not comfortable coming back, even though all hospitals, private clinics will be creating spaces that are very safe or as safe as possible.
Mm-hmm.
I think you'll see that as well. So, again, nothing's perfect, but I think knowing that we're opening mid to end of May, having an actual time frame and having a plan is so encouraging to me as a provider, and all the patients I've spoken to are very excited about that as well.
Absolutely. So when you say mid to end of May, so there is no actual specific date?
It can't be a hard date because the genesis of this was that most developed countries have clinical societies that govern well, not govern, but they recommend and they guide decision making. So in the case of Canada, we have the Canadian Fertility and Andrology Society, the CFAS, which has an excellent website with great documents, both for general fertility care as well as specifically for COVID. And the executive has been amazing in terms of
Mhm.
providing leadership. But one of the key points they mentioned was that we really need to make this regionalized. Each province has to look more closely at because really that's who we subscribe to, right? It's the laws of the province, the laws of the city that you live in that really dictate. So there have been some national recommendations, which most of what I've mentioned will appear in almost any clinic you go to in Canada. But
Right.
then specifically for Ontario, the IVF clinics of Ontario met, and the directors came to a consensus, and they felt that mid to end of May was consistent with what the rest of Ontario is doing, and it's consistent with the directives from the Premier's office as well as from the Mayor's office of at least Toronto, but which reflects most cities. So that's kind of how it evolved.
So I want to add to it because a lot of people, a lot of women in particular, as they go through these kinds of procedure or are expecting to go follow through with a frozen embryo transfer or starting an IVF process, they're saying they're knocking on our door, emailing, calling, and saying, "Hey, we want to get back and do acupuncture." Which puts us in a bind because our specific college says, it's a non-essential service. We can't do this. And just prior to us getting online, you said something really great. And I would love for you to share with everybody your thoughts around how we can be creative about having you get your treatment.
Well, I don't want the president of your college calling me out inappropriately, but as long as as a society, we are sticking to the principles of protecting all those involved. So in the case of the fertility clinic, protecting the staff, protecting the patients at all levels, that would apply to anyone visiting the clinic. And so even though we're trying to minimize the number of people in the clinic, if we agree that supportive care in the form of traditional Chinese medicine, acupuncture, acupressure is essential to that treatment protocol, then as long as the visiting provider like yourself properly donned and doffed the protective gear, I think the only piece would be, is the acupuncture itself, the provision of that care, considered safe enough? And well, if you're prepared to do an embryo transfer, an egg retrieval, those are just as close as acupressure would be. Maybe you would want to limit the time, or maybe just select points that were more critical in your mind. But I can't see that from a conceptual perspective increasing the risk to anybody, as long as you went through the proper screen, which I think is very an important point as well, Mary, which is that everyone involved, staff, providers, allied healthcare, they need to be prepared for, at any point, treatment cancellation or treatment deferral. So for example, let's say we were able to find a way to get you into the clinic to provide TCM. If you came down with a fever on that day, you're not coming into the clinic. So,
Absolutely.
so you'd have to be prepared, excuse me, for that to occur. And I'm also stressing to any patient that comes through, even though we are now preparing for a soft opening into the mid to the end of this month, that does not change the fact that at any point there could be a second spike in cases, that as an individual, you may come down with COVID symptoms and be canceled. So all of that needs to be taken into consideration. And that would also apply to treatment deferral. So if someone was planning to start but developed that, we may need to push off and say, you know what, you need to wait. Actually, the recommendation is 21 to 28 days, so almost 4 weeks of waiting. It's not 2 weeks. So that's an important element of flexibility that we'd have to consider. But I think it's worth chatting about. I mean, this might be an offline conversation, but in the case of the fertility clinics, there were executive task force that were created to provide like working documents, and that's probably what your college needs for direction.
Yeah, I think that's a really great call, and I'll put that forward, and I'll share this conversation with everyone, and because it's an important one. And as our patients tell us, it's like this is essential, right, as part of their care. So I just, I would feel bad if we couldn't provide the service. And
Yeah, I think another important point though is, when you said essential, I mean, there's no question that we all agree, and we've talked about this on sessions before, and the American and Canadian fertility societies have all been very clear that fertility care is not elective. Fertility care is essential. Infertility is a disease, and no one is questioning that. I think that message has gotten lost or was sort of muddled by how society treated fertility care and how clinics were closed. And some providers were criticized for not opening. But the message we were trying to send was that no, this is essential. But 1 or 2 months of deferral is not the same as someone who's actively has COVID or has cancer or has a trauma, and that's why we had to defer.
right.
But that's why now, I can speak for North America. North American providers are standing up and saying, okay, enough is enough. We now understand what we need to do to the best of our ability to provide a safe place for everyone involved. But I want to mention something that's really important, and you're going to start seeing this in the fertility clinic, which is anytime you go for a procedure, when you do a procedure, Mary, when I do procedures, we have consent forms. And consent forms are there to inform people that, yes, we're all good providers and we believe this is the right procedure, but things can happen, complications. And fortunately, in fertility, they aren't typically life-threatening. Most of them are minor, but we do have a very extensive consent form to cover that. There will be a new COVID waiver that all
Absolutely.
patients have to sign. And when you read the document, it can be a little scary because, I mean, and we don't make people who are trying at home sign a COVID waiver in terms of safety on themselves, on the pregnancy and the unborn child. But even though we believe we know a lot, we don't know everything. And COVID is novel for a reason. So I am preparing patients for the fact that that waiver, at least those coming through a fertility clinic, will be a requirement moving forward. And most websites have that document, and it's a standard document. It was designed nationally, and so there's some version of it on most fertility clinic websites. And I have to be honest, I don't know if it was a required, but it was a strongly suggested requirement to sign that document before care. In our clinic, it is a requirement.
Well, I would assume that it should be required, really. Yeah. So there's a couple of questions before we go on, I believe. Can you comment on whether these measures will stay in place indefinitely? This is by Maria. Thank you, Maria, for asking. And once COVID subsides and or a vaccine treatment exists, will fertility clinics go back to how they operated pre-COVID? Good
Right.
question.
So those questions are linked, which are, is this the new normal? I would say for at least the next 6 months, this is the new normal. It really will depend on two factors. So one is, what direction does COVID go? So if we are providing this new normal and the COVID cases continue to stay flat and drop, then we know we're on the right track, and we'll probably continue that until we see other metrics that are supportive. There's a very specific metric they use, which is, you may have read about this. It's they look at how many cases does each individual patient influence. So you want that number to be less than one. Like right now, I think it's as high as 3 or 4, meaning each COVID person is infecting multiple people, or it's been as high as that number. And in areas where the COVID crisis is diminishing, you're seeing the number drop below 1. So that means each COVID case is not leading to that many more cases. And so those kind of metrics, which really reflect community spread, if those numbers are all good, then maybe there'll be a discussion of reducing the level of social distancing that's required. But at this point, it will be this way for at least a half year, if not longer. And then the other factor will be the vaccine. So most vaccines take a decade to develop. If you've been reading and following the media, vaccines are within a year, they believe, which is pretty amazing, that whole acceleration. A vaccine will be critical for normalizing society, because that will allow people to interact more safely. It will allow clinics and public spaces to be more accessible, but there is no vaccine that's currently available. So I would say that what you're experiencing now in the clinic it will be the way it will be for a while. There may be incremental changes, like perhaps as clinics become more comfortable with this sort of semi-open nature, maybe they will find other novel ways of increasing flow. But for now, this is the way it's going to be for at least, I would guess 6 months, but that's just a really rough number.
That is a rough number. I personally think it'll be longer than that, but what am I to say? Yeah. So here's another one, a very specific one. I was wondering when Nurse Anya will be back from being laid off due to COVID-19.
Well, these sessions are meant to be very general, but thank you for who posed the question. I think in general, many clinics, I'll answer in general terms because it's not appropriate to answer those specifics, but most staff, like other areas of society, have been put on what we call temporary leave, or sort of like, a forced leave that has an end in sight. And the intention is to hire back as many people as possible, obviously matching the demand. So the hope is that clinics will require more staff back, and that the staff that there'll be retention. The staff that were put on temporary leave will return once that benefit program starts to expire. In terms of the specifics of each clinic, I don't know. I don't think it's appropriate to answer specifically Nurse Anya's plans, but she is an amazing nurse, and as are all of the nurses that help that assist in fertility care. It's a very special area of medicine. We're very fortunate in our clinic, and I've encountered many fertility nurses across the country, and I hope that as many as possible are hired back and they keep doing the special work that they're doing.
Thank you. Another question, will the new measure cause a wait for testing? Kind of address this.
Well, so there's different types of testing. So if you're speaking about diagnostic testing in terms of fertility care, I don't think that there'll be a radical wait, because remember, for the last 2 months, we haven't been doing any testing. And so all that's going to happen is just the number of people that are flowing through might be a little bit less, but I don't think it'll be a meaningful delay. If you're speaking specifically to COVID testing, well, that's another very interesting area, which is accessibility to high quality, high fidelity tests, which is one of the biggest challenges. And that's all over the media. Today in the US, there was the president gave a press conference on how many tests are being done and the need for testing. I think the big gap of care there is how high quality are these tests? How accurate are they? And then are we just testing the virus, or are we testing immunity? Which is another very interesting question, which is right now we're really focusing on the lungs. So testing the nasopharyngeal, the nose mouth area. Because for quite a while we believed that really the virus was not in other parts of the body in meaningful numbers, and specifically to fertility, we were pretty confident that we weren't seeing virus in seminal fluid like in sperm or in amniotic fluid, and now there are some reports saying that in people that have been affected there might be small amounts of virus RNA or the genetic material of the virus. I think the deeper question there is that virus that we're seeing there actually potent? Meaning, if you see virus in the sperm, is it dead virus, or is it a viral particle that can actually infect people? And I think that the reason that's meaningful is the last thing we need right now is for COVID to become a sexually transmitted condition, because that would obviously complicate things. So I think right now, anything you read about that is very preliminary. Um, we're talking about maybe 20 or 30 patients that have been evaluated. So the takeaway right now is that COVID is a respiratory um, aerosolized kind of condition. It is not one of the blood or of the urine, of the stool, or of the semen or vaginal secretions, which is good so far for us.
Right. And then, so anything with regards to IVF funding, will there be a deferral? Anything, any new
So,
knowledge about that?
right, so when you sit at home and you watch and you follow all the government grants at all levels, federal, provincial, it's pretty impressive. I mean, this is looking like what the world looked like during the wars or during depression. I mean, the amount of support that's coming to us, and the dollars are just incredible, and it really makes you scared to think, well, will IVF be on the chopping block? Like, will they take away that kind of funding because they keep mentioning that it's non-essential, so maybe the funding isn't essential? And I can reassure you that there is no indication from the Ministry of Health, at least of Ontario, which is the only funded province right now, that that program will be compromised. In fact, there is full indication that program will be present for the long haul. The only question will be, and that's more for the clinics, is how will that funding be distributed, because there were a few months where we weren't doing any care, and there were a few 2 months or 3 months worth of IVF funded cycles that weren't being performed. So I think that's like a bit of a nuance that your clinic will have to deal with. But big picture, there's no indication that the funding for IVF is being removed. It looks as strong as ever.
Great. And then, so here's another question. Will intended parents be allowed to attend procedures with their surrogate?
That's a great question. And so that's one of the unfortunate consequences of reducing face-to-face interaction, which is, and social distancing. Uh, if you can picture it, that if every single couple that was coming through, or individual, had an extra person, you immediately go from a socially distant location to something that's quite saturated. So unfortunately, even though we feel strongly that everyone involved in a fertility case, whether it's the partner or the support person, um, anyone involved is critical, because all those pieces make up that pie that helps complete the case. We do have to whittle it down to the most essential providers. And so in a case like a surrogacy case, the most essential provider would be the physician, a nurse, the embryologist, and the surrogate. Now, we've talked a lot about this in our clinic, and what we're hoping is that if these measures are stable, we may be able to add in a support person in the future if we can control numbers. But right now, the mandate is to really be as minimalist as possible. Now, that's not to say that we can't bring people in virtually. So just like we're doing virtual consultation, we encourage people to bring in a smartphone, FaceTime, Skype, Zoom. These technology. To me, I was talking with some colleagues that even though the vaccine will be the ultimate weapon against the pandemic, there have been so many other tools that we've had, and social platforms, social media, these platforms have really helped us survive. Can you imagine what life would be like without this? I mean, I don't know how we would communicate. How would
It's
we
amazing.
handle it? So in terms of the specific question, right now the goal would be to minimize, and that's for your safety and the surrogate safety, but we encourage to bring in a smartphone. And we're pretty good at at least in our clinic, we're really very good at creating a almost like a studio effect. So we typically have a screen, the embryo on the screen, we have the ultrasound on the screen, and we have the provider talking to the screen. So we also have some takeaway pictures that we can give. We also have something called the EmbryoScope, which is a video of your embryo that we can provide on a USB key. So I'm never going to say that we're replacing the live human. Nothing replaces that. But a live, successful, healthy, COVID-free birth is the next best thing. And so that's what we're trying to do.
Right. And so, to expand on that further, women that are currently pregnant and going to be delivering babies, their partners typically are not even in the room now, right? So it's the same thing.
Right. So that's an area. I mean, again, I'm peripherally involved in that because we help many, many people become obstetrical patients,
Yeah.
and we stay in touch with them, and also being part of the hospital uh, with Sunnybrook and Mount Sinai. I'm privileged to a lot of the decisions and plans that are there, and so again, in that spirit of trying to minimize the number of people flowing through, there have been some discussions on when the partner can be present. It's not completely removing them, it's just really limiting the points of contact. And also, the other important point, excuse me, is whether someone has been identified as having COVID or not. So that's an important piece because if you actually develop COVID in pregnancy, you'll have one set of treatments and isolation. Whereas if you're not with COVID, you'll be treated another way. So, that hopefully, you fall into the category that's non-COVID, excuse me, but that's something. And also, all these policies, you really have to have your finger on the pulse of the institution because they keep changing, right? They keep changing, and I hope they keep changing in the more permissive direction. But if things start to spike, if there are more cases, if the metrics aren't supportive, then things may close again, unfortunately.
Agreed. Hopefully not, but okay.
Yeah.
Let's just move on. Okay, so Lara says, thanks for this great talk. Just to clarify, has the province of Ontario agreed that fertility clinics can open now?
Yes. Yes. The province of Ontario doesn't specifically speak to fertility clinics. They speak to medical care. And we were lobbying the province during the closure to get sort of exceptional status to help us open more quickly. Um, but these are typically, fertility clinics are organized by a national society. And then provincially, the doctors of Ontario, all doctors, fall under the Ministry of Health and the Ontario Medical Association. Like those are typically what control the province. And so, um, right now, there are announcements coming from Queen's Park every couple of weeks. And fortunately, fertility care is going to, like, they're not going to pull back these plans. I mean, these plans are consistent with what the ministry has supported, but certainly at any point the ministry could come down and say, no, this area of medicine has to be shut down. But right now, the plan is, like we said, mid to end of May. So if you haven't heard from your clinic yet, then I encourage you to contact them because those are not directives, right? Those are just suggestions. And if a clinic is not in a position to properly screen, pre-screen, protect patients and staff, then they can't do this, right? So this really needs to be at the clinic level as well.
Yeah. And so for those of you that do acupuncture at Alive Holistic Health, we are putting measures in place so that we can open as soon as we get the word A-OK, and then we can just keep going. And in the meantime, for those who have seen me talk, lately we've been utilizing acupatching, which is using light therapy patches with these crystalline structures that allows our body's electromagnetic waves to hit this crystalline structure, and it reflects back at specific frequency of light, and it'll enhance and produce biochemical changes in the body similar to acupuncture. So we're using that in place because we cannot do acupuncture physically right now. So if you want more information on that, you can always just get in touch with us at our clinic, which is clinic@aliveholistichealth.ca. But there are more questions. So let's
What was
just,
our acronym again, Mary, for your new telemedicine?
oh, you
Tele
said teleholistic medicine, right?
THM, yeah. So
THM, yeah.
teleholistic medicine. Wow.
Teleholistic medicine. We can do that with acupatching. So, oh, this is interesting, just timely. Acupuncture is essential for my fertility care. I hope that TCM College reconsiders its stance and lets you start caring for your patients again. Thanks, Mary, and hi, Dr. Baratz. Okay. Do you get a sense that the surrogacy landscape has or will shift due to COVID, meaning more available surrogates in Canada, as they may be hesitant to take a journey with parents outside?
Well, well, surrogacy. I mean, in terms of how COVID would affect surrogacy, I think that comes back to that waiver I mentioned, which is that, I mean, we now have almost 9 months worth of COVID experience with pregnancies. I mean, the general principle is safety for mom, safety for baby, and safety for everyone involved. And if we felt that carrying a pregnancy during COVID conferred significant risk to the mom or the baby, then we would just not continue. The waiver is just there to protect in the off chance that some knowledge becomes available without anyone, as we get more COVID experience. But I think this, in terms of inspiring or in terms of increasing the demand for surrogates, surrogacy has been on the rise for the last 10 to 15 years. And more women are learning about surrogacy as it becomes more and more public. But will there be a spike? I don't think there'll be any specific spike because it's already on such a steep rise. But
Mm-hmm.
I always hope that people who need surrogacy can find surrogates. And I always hope that people who want to be surrogates, which is such a special thing, can find the right intended parent. But yeah, that's a massive part of my practice and at the Create Fertility Center. If you have specific questions about surrogacy, I'm more than happy to have a consultation about that topic via telemedicine. So you can visit our website and request a consult.
Okay, thank you. And then, so piggybacking that, and I think we know this, it says, do you suggest women to wait if possible to get pregnant post-COVID? We don't know how long to wait.
Right. So we don't really have a post-COVID yet. I mean, if you mean post-acute COVID, because the pandemic has not been removed. So we're living in COVID now, and as per Mary's comment, COVID will probably be here for another 6 months, if not longer. I think we need to learn to live with COVID. COVID will probably be here, just like other coronaviruses that we have in society. We develop vaccines for them, or they come and go like the weather or the seasons. But I don't think there will be a extinction of COVID in our right now. So the next best thing is to develop safety or knowledge of safety in spite of the COVID. Should you
I
defer?
agree 100%. Thank you for
Yeah.
that because it's about not like succumbing to fear and stopping your life, right?
Well, the tone has changed, or the tune has changed a lot over the last couple of months. So at one point, many of the obstetrical and fertility societies were actually saying that people should alter their fertility plans, be those natural or through obviously the fertility treatment was limited, which was a very bold statement because I guess it was the safest reaction at the time. But there's no license that somebody needs to try at home, and so it became potentially very discriminatory against people who needed fertility care. So fortunately, the storm of COVID has not yielded significant obstetrical um, complication. I mean, there still are complications like any pregnancy, and that's a whole other discussion. But just to sum it up, not one obstetrical society in the U.S. or Canada or Europe has said that men and women should completely stop their baby making because of COVID. But that being said, is it dangerous for someone who is a good fertility patient to wait 1 or 2 more months? No. I mean, you have to live. You have to live inside yourself, and you have to live with a certain level of comfort and fear. For many people, that's a reasonable comment, but for some people, the fear is just too great, and they may need to wait a little bit longer. But we don't prescribe that. We're not
Right.
telling people to wait any longer because of that, because I think that you'd be waiting indefinitely, and then what may happen is a second spike may happen, and then you may have limited access to the clinic. So I think you have to look at what's going on, which is if there really was some severe issue with COVID, we probably would have seen it by now for an obstetrical patient or for a baby. We just haven't seen it.
Right. Which brings us to this question. Are pregnant women at higher risk of severe COVID illness? I haven't seen it.
Well, I mean, pregnant women in general, pregnancy does have some potential for immunocompromised conditions, right? So in general, we know that pregnant women, if they're in a room, they're the one that's going to get the cough or cold because their immune system, the whole
Potentially.
potentially, but they're probably a little more likely to get that. We know that if a woman was to get a pneumonia, a pneumonia in pregnancy typically is a little more severe than a pneumonia outside of pregnancy. And so that's really one of the concerns is if they were to develop a COVID-based pneumonia, how severe can that get? And that really represents probably less than 1% to 2% of pregnant women. Most women will have some kind of transient illness, viral illness, or nothing. And again, it hasn't really percolated down to the babies. There is some suggestion that maybe some of the pregnancies may be associated with preterm birth for those that have COVID. Again, this is assuming that someone gets COVID. Most people, many people, because of all these social distancing, are not going to be exposed as much. So I would say the net of all that is it's looking very safe. But again, you'd have to really speak to your own provider, your own OB, to get a more sophisticated response based on your case. I think anyone that has any comorbidity, so if you have other health issues, like if you have lung disease, or if you have diabetes, or if you have a problem with blood pressure, this is a great time to optimize those things, because that's something that I would not want to throw COVID on top of, because we do know that COVID has hit harder people who have other conditions. And those are even things like obesity. People that are overweight are probably getting worse COVID experiences. People with uncontrolled other conditions, like other medical conditions. So if that's the category you fall into, then I would definitely put a pause on baby making and optimize. That's like another excuse to optimize those areas before trying.
Exactly. And I really want to thank you for bringing that up, because this gets lost. It's like, look at it as an opportunity for you to be able to shift your health and your life so that you can focus on that piece first, and then you may be less susceptible
I have
to.
seen, it is incredible, Mary, if I just may, even though I never want to diminish what we do as you and me as providers, I really do believe that we bring pregnancies about that probably may have not happened on their own, but we're not perfect. And there are cases of people having like that we tried to help and that for some reason took a break from care and they got pregnant spontaneously. And I'm
Absolutely.
seeing a little spike in that happening during COVID. Like a few patients that I've been working with over the years that it just wasn't clicking despite many attempts had spontaneous pregnancies.
Yeah.
And we know that many conditions or many diagnoses in fertility are part of a spectrum, and that there are some severe conditions, but there are some that can get pregnant spontaneously, even with their diagnosis, whether it's endometriosis or irregular cycles or fluctuating sperm levels. But I think what's also happened is COVID has forced them to optimize, whether it's losing a bit of weight or maybe gaining a bit of weight. But I have seen a little uptick in spontaneous pregnancies. Now, that's definitely biased by people not being able to access the clinic. But I think it's impressive that people have still been able to work around some of that optimization and be successful.
Yeah. Well, and I will also address the psycho-emotional piece, because here's the thing: when people are really actively trying, they're like heart and souls in it, and it's like another full-time job, and that in of itself causes stress. Sure, COVID causes stress, but it's an opportunity to now have you be at home, take care of yourself in your life, and so in another way, you're actually decreasing some of that fertility stress. And who knows, right? Like we can only, I always say, with science, with acupuncture, TCM, we can only do so much. And at the end of the day, nature does its thing, just like nature is doing its thing right now, like in a really big way with COVID, right? So,
Well, yeah, I mean, look, there's definitely aspects of society that have been put into check. Certainly, my heart goes out to the more senior members of our population. I think we've noticed, I mean, everyone has seen this, that even though we're all affected by COVID, it really has struck the more senior aspect of our society. Probably 80 to 90% of deaths have come from people over the age of 70 or 80, I believe, which there's two ways of interpreting that. One is obviously we now know the higher risk groups and we need to protect those people. I think in some areas we have not done a good enough job in terms of our nursing homes and our senior care. But it also tells you that when you remove that part of when that part of the population is not part of the demographic, there is more safety data on the people that we help, which are women in their sort of 20s, 30s, and 40s into their 50s. So, look, COVID it's a bad thing. I mean, no one's trying to overemphasize the silver linings, but we always try and find ways of working around it. And I think as a society, we are doing our best. And we're definitely committed to continuing doing that.
Oh, okay. I don't know if we can just keep on going with this, but oh, why is my clinic saying they are delaying FET and starting IVF cycles if you're saying that clinics are opening all procedures at once? Um,
Well, sorry, let me clarify. So well, as I mentioned before, no clinic is saying they're opening up all procedures, meaning like everything is being phased in. And each clinic has to be able to provide, and this is not just our clinic, but the whole country has to be able to adhere to the principles that we've been talking about, which is maintaining limiting the face-to-face interactions, maintaining the social distancing, doing the screening, and maintaining the protective equipment for safety. So, I think all clinics share a motivation to open because that's what they're there for, but there just may be a bit of a staggered start. So even our start is, our intention is mid to end of May, but we may need to delay it. Right now, we're actively planning and we're preparing, but all of the patients that we are getting ready for this know that there may be a deferral or cancellation of their care if something changes. But I think I would contact your clinic. It might be that they're using some type of triage system to bring people in, but pretty much every medical director that I've spoken to that's involved in care for the province is preparing for mid to end of May. At least that's what most are saying.
right. Okay, great. Thank you. So Maria says, this is a personal question. Have you been able to visit your newborn nieces yet? You mentioned it in your previous video that you had just become an uncle. So
Thank you. Yes. I became I've been an uncle for a while, but I've added to my
collection.
load of nieces. And thank you for asking that. I'm happy to answer that personal question and to say that the closest that I've gotten to my nieces has been 2 meters. We haven't, we all practice what we preach. And even though we believe that the younger population, children are a very interesting area in terms of the demographic, in terms of their role, in terms of spreading COVID. But I'm lucky. I live not too far away from my family, and so we take a lot of walks. So we do a lot of outdoor activities, and one of our weekly routines is to walk to one niece, and we see her through a 2 meter distance, and we talk to them. And then with the other niece, a little further away, we drive. And we just talk to them again from no more than 2 meters. And then we're very active on Zoom. Our family, we have family Zooms every week. And we've had a few other milestones in our family. We've had some birthdays. And so that we've had birthday Zooms. So Zoom is a big friend of our family, as I'm sure it is of many people on the call.
Yeah. All right. Well, thank you for that. And thank you for all your insight and all the information. And so we're going to leave it for today because I think we've talked a long time. I actually have no idea what time it is because as I have all these things up, I don't have the time on the devices. But for those of you who are joining the first time, Dr. Baratz have had multiple interviews with me through Fertility Talks. So you can check it out, number 159. And that actually was one of the first interviews about COVID and its consideration. So you can look at that. And then we talked about the good news, which is live post number 161. So check that out as well. And as I mentioned, today was an extra add-on fertility talks, but on Wednesday, we're actually going to also speak to fertility hormone testing at home. So that's this Wednesday, 8:30 p.m. Eastern time. So check that out and like the page, which is at Alive Holistic Health Clinic. And you can also go through my YouTube website, which is YouTube channel rather, and it's Meet Mary Wong. So check that out. Watch all the all the information that we've got going on here. And next Tuesday during the day, we have a live community event where we're going to give you basically mini sessions of like hope and advice. It'll be awesome. It's going to be our part 3 in our series. So definitely check that out and register or contact us at our clinic so you can register. And we shall see you Wednesday evening. Thank you, Dr. Baratz, for your time, effort, and your care. Love this. I know we'll do one again soon. So
thank you, Marian. And I just wanted to say thank you for all the work that you do and for hosting. Nobody loves COVID, but I have to say that I've been so impressed with all of the providers and the resilience and the patience. I think there's been a level of humanness that I've seen in society that's been elevated. Not even though everyone is so frustrated, I've been so impressed with the people I work with the patients I care for, and their providers and their loved ones, on how supportive people have been. It's been incredible. So, thank you to everyone for everything that you do, and for being Canadian, Torontonian, Ontarian, wherever you are. But thank you. And I look forward to seeing you in the near future.
That's great.
Good
And
night.
I think there's more people beyond Canada watching this. So thank you internationally.
Okay, take care. Have a good night.
You take care. Have a great night, everyone. We'll see you on Wednesday night. Bye
Bye
now.
bye.